Hey,
Okay, I'll mute myself here.
how's everybody doing today?
Hello, everybody. I'm trying to get my camera on. Oh, there we go. I think I saw some of y'all yesterday, right, Lori? You were there.
Yes. Good morning.
Good
Hi,
morning.
Mike.
Hey, how you doing?
Hi, Matthew. How are
I'm
you?
good. A long time no see.
I was doing my last day of lab testing. It was a long
Oh, it's
day.
a long day. I know.
Yeah,
I think we're,
105 and 106.
Yep. Yeah.
I think we're still waiting on a few others, so if we can just wait a couple more minutes, that would be wonderful.
No worries. I'm just
I see we still have some people joining.
no rush.
Hi, Vera.
Hello.
How you doing?
Good. How are you?
I'm good. I'm good.
Okay, while we're waiting on everybody to join, I'm going to share my screen very briefly. Those of y'all who don't know me, my name is Dr. Palakis. I'm the Department Chair of Nursing here at Sumner College. I took over this position, I can't remember. Feels like a long time ago. But I am here and really found a need for virtual simulation training. At the moment, there are very few of us here at Sumner College that can do it. And so there's really no barrier to why any nursing faculty can't do it. So I wanted to take the time and do that. And you'll also get credit for being here today for one of your educational in-services. Matthew Wong's going to be here to help me today as well. But I'm going to just first share my screen and just go over the purpose. That way we can get credits for today. Purpose of today's virtual simulation training is to improve patient outcomes through virtual simulation and to present the best practices for nursing education. And I'll go into more detail, and I'm sure Matthew will as well. But virtual simulation is not just thrown at the students. It has to be pre-brief, well scripted. We have specific documentations and regulatory bodies in the Oregon State Board of Nursing that we have to be compliant with. So we're going to go over all of those today. Our learning objectives, we're going to identify 3 benefits of virtual simulation for nursing competency. We're going to describe the Oregon State Board of Nursing standards for virtual simulation, which is an important piece, and then apply best practices for simulation, debriefing, and educational settings. My credentials are I have a DNP, a master's in nursing education, a bachelor's in nursing, associate degree in nursing. I'm also a certified nurse educator. I do have extensive, I believe over 10 years experience with simulation, virtual simulation, and in-person training as well. So without further ado, I'm going to stop sharing. And Matthew, I don't see, oh, there you are. Would you like to start off for us and kind of give a nice overview?
Sure. So
Would you
just
like to introduce yourself for those who don't know you?
yes. Hi everybody. It's nice to meet you guys all. Appreciate you guys joining. I think we've all kind of connected. Maybe either virtually or on an email. But my name is Matthew Wong. I am the representative for Lippincott. So we are the vendor that Sumner College uses for their textbooks, their clinical and simulation products. So it's likely that I've set up access, or that you've joined in one of these calls before. So the purpose of today is to kind of walk you guys a little bit through VSIM and share a little bit specifically just a training on this product. Before we get too deep into what it is, you know, VSIM is a you know a a a desktop version of 10 up to 10 per nursing 10 to 20 cases that your students will virtually take care of a patient. So after this call, I have a sheet that has all of the breakdowns of the subject areas. I believe we're using fundamentals, mental health, and I I think maybe some other topic areas.
We have health assessment and
Health assessment, that's right,
pharmacology.
and pharmacology, yeah.
Yes.
It's also included in some of the course points that you use. So if you're teaching med-surg or you're using Hinkle, if you see that course point plus, the plus means that VSIM is included. So some of them are integrated into the book course resources as well.
Do you want me to
Uh,
share my screen, Matthew? Do you think that would be helpful?
yeah, that would be great. Maybe you could share your screen and then I could walk through the courses that you have.
Okay. Hang on, I have so many tabs open. Let me get back to it really quickly. Okay, I'm going to share my screen. That way everybody can kind of navigate through it. Again, I don't know if I mentioned, but we are recording today, and this recording will be disseminated to everybody, all the faculty members for reference. I believe Mrs. Seagraves is also doing some screen recordings that we're going to disseminate as a resource. And Matthew, I'm sure you can tell them there are so many resources within the point as well. And I do have a brief presentation once Matthew is done. Okay, so can you
Okay,
see
so
my
let's
screen?
start. Yeah, so let's start here, everybody. So actually, Kim, this is great. If you could just kind of navigate the platform while I talk through things, I think that'd be really helpful.
Okay.
This is the point. This is the platform where all of the resources will live. From your ebooks to your course point to your VSIM, it's all going to live here. Should any faculty or instructor, should you ever find yourself needing something, I'm the person that will give access to you. So feel free to, I'll put my email in the chat. I believe we've all been connected before. I recognize a lot of the names. And I always do my best to turn things around quickly. So just let me, just so you know, this is the point. So if Laura, if you scroll down, um, so what you're gonna see are the books, but at the bottom you'll see the VSIMs. So to get into the VSIMs, all of our resources are integrated to have a grade book, to have assignability. So they're all mapped to a course. So to get into any of these products, to get to any of the resources, you're gonna want to click that Launch to Courses button. And you can do it for any product because that will pull up your courses page, which will then allow you to access a resource. So here we have the VSIMs that have been created. A lot of you guys, if you haven't are doing this for the first time, you're not going to see anything. You're just going to see that welcome to courses page. But don't worry, if you scroll to the top, Kim, there's that create new course button. If you create a new course, select that. All you have to do is select the product that you want, name your course, fill in some information, and then it'll be active.
Do you want me to walk through it?
Not right now. You can close out of
Okay.
it. Typically what's gonna happen if you're a new instructor is that there's somebody, you see that first course created by Linda, like there's gonna be someone in the registrar's office, or probably Kim, or probably me, or it's probably some combination of the both that will create the course for you so that you don't have to do that lift. What's nice about the courses page too is if you click on that course settings button, Kim, on that first course, there's that little gear that says course settings. You can copy the course. So if Kim and I are working to sort of standardize things moving forward so that we're having more of the at least the classes mapped so that when you're teaching when you're using VSIM for clinical for for the next term, you could just copy the courses and all of the assignments will copy in. Does that make sense? And I'll show you some of those functions as well. So why don't we go into this VSIM and then we can kind of understand what it is. So click on content. So this is what VSIM looks like as a standalone version. That's what we're typically going to be noticed. Couple things, right? This is the health assessment product, and this is next gen. We updated all of the VSIMs to have NGN question types. So in a second, you'll see sort of the learning loop module of how all the VSIMs are built. In that kind of learning loop, there's pre-SIM questions and there's post-SIM questions that are all graded. And
Do you want me to click on a patient?
not yet. We'll get
Okay.
in. But in that learning loop, you'll see that in that those questions, the next gen, you'll see next gen question types. On your left side, there's those same that left bar, the content, you have assignments, you have results, and you have rosters. Let's just go through these really quickly. Content is obviously all the content. So in that center, you can see, like I said, every nursing topic has 10 to 20 cases. So health assessment has 10 here. So in that, on that right side of the screen, you're going to see instructor tools. And then you're going to see next gen debriefing guides and next gen scenario overviews. These are going to be really beneficial for you. So if you click on that next gen scenario overviews, this kind of gives you a breakdown of, and you can just view one of those. So you can kind of see, click on, yeah, Josephine is a good one. It'll give you a breakdown of the patient diagnosis, brief summary. And I actually have a spreadsheet too that has a lot of this more concise as well that I will send afterwards.
If you don't mind me interrupting, Matthew, I just want to really drive home to everybody out there that all of this is directly aligned with all the regulatory bodies, with our Nurse Practice Acts, and everybody for us to be within compliance. But the key with that, and I have a presentation, as I said, when we're done, is that we're ensuring that we're using these resources. They're really important because if we're not using them, then we're not going to be in compliance.
Right. All of our, and additionally, VSIM and all of our books that you use, they're all mapped to the AACN essentials and then also to the QSIN competencies. So if that's helpful to you as well, I have that in a spreadsheet. And I'm happy to send over that information afterwards. If you close out of this, Kim, this product is for the instructor. Also the debriefing guide, if you click on one of those for Josephine, let's click on Josephine. This is something you can use in lecture to sort of supplement and or bolster kind of the resource in a classroom setting, or as a homework assignment as well. And then there you can see there's a QSIN competency, and these are just sort of, again, as we get into it, you'll find kind of how you want to integrate it. But should you be doing it for the first time, definitely take advantage of these resources. We have a full team of nurse educators who work full time at Walters School or Lippincott, and all they do is create these documents. Also, if you're finding that you want something more, we're always open to like feedback from end users and utilizing our team to do that. I got a question from QSIN is just another kind of competency. I'm sure someone else on this call can speak to what QSIN is better than I.
So we spoke a little bit about it yesterday for those of you who were in the clinical faculty meeting. But QSIN is essentially, you can see quality and safety education for nurses, and it has QSIN competencies, and these are them: patient-centered care, teamwork, collaboration, evidence-based practice, quality improvement, safety, informatics, and you can see it links you directly to QSIN. And that's something I'm going to talk more about on Thursday in our nursing faculty meeting. We need to be incorporating QSIN into our curriculum consistently, and it should be within all of our clinical courses. So I'm going to give you some creative ways to embed that. And we can talk more about that again, either at the end today or Thursday during our nursing faculty meeting. But thank you for the question.
Great. All right, so you guys ready to see VSIM?
Yeah.
Did I kill enough time? You guys bored yet? I'm just kidding.
Yeah.
All right, so let's get into VSIM. So like I said, each VSIM virtual simulation is a case-based scenario. So let's just click into that case, Josephine Morrow. This is going to launch that kind of learning loop that I was talking about, right? So in that left-hand side, left-hand top corner, right, you're going to see kind of the 6 modules of this learning loop. So for your students, they're going to start with some suggested reading, right? So similar to what you'd be getting, right? They're going to be getting a report from the charge nurse, right? So what we've done is try to create that scenario where, they're not physically, engaging in what they're doing, but like we're building the kind of clinical judgment and decision making that they're going to be needing at bedside by giving them sort of a safe environment to sort of think through how they're going to be a nurse and make active decisions on how they're going to be a nurse. What's nice about this as well is if you scroll down, it references the book that we're using, the pages that we're using, where to find the S bar. If you click on those little green smart link buttons, that's really great too. So it says expert clinical content from Lippincott Advisor. I know I've talked about this before on our course point trainings. I recognize some of the faces and I've done some, onboarding for some of you guys, but do you guys remember what Lippincott Advisor is? So think about, if we're talking about evidence-based kind of tools, here's one of the best evidence-based tools that you have. Clinical Lippincott Advisor is included with all the products. And what it is it's a point of care reference tool. So like I live in Los Angeles, Cedars-Sinai Hospital, unfortunately someone in my family was in the hospital. I looked over the shoulder and I saw them using Lippincott Advisor to double check a dosage calculation. So we're a big company. We don't just sell to nursing schools. There's a side of our health education that sells directly to hospitals and healthcare facilities. And this is a product that is actually licensed by hospitals and it's included for free in all of your products. So if you want to utilize an evidence-based, kind of reference care, that little button, if you ever see it, point that out to students, take advantage of it, use it. It's a really huge resource that's included in VSIM.
And if you don't mind me interjecting, just to let faculty know, this is part of the pre-briefing for us. It's so important because our students look at all this information that's in here. So I give the students enough time to do the reading. They look at the S bar and take notes. But this is basic with obesity, but I did one with peripheral vascular and peripheral arterial disease last week, and it was really good for them to kind of brush up on all of that. And we've got patient teaching, nursing considerations, everything, the assessment, test results. So it's really great. And, every time I see one of these little green clipboards or stethoscopes, I'm not quite sure what it is. I guess it's a stethoscope, but I do ask the students to do this as part of their pre-sim work, is to click on every single one of those and get familiar with it.
Yeah, and it shows up across the program. So like, for example, in all of the Prep U quizzing, in the answer keys, there's always like one of those green buttons. So like in the answer keys in the quiz, you'll see like they can go back and look up the answer. Denise, you had a question?
So yeah, I did have a question, and maybe we're going to talk about this later, but so if I had a group and I'm doing a VSIM with them, are they looking at everything at the same time, or am I just sharing my screen, or are they going in through their computer and clicking so they can do all that, get to Lippincott as well?
That's a great question, Denise. Thank you for asking that. So we have been a little bit creative. Last week, I think I told most of y'all I did, I think 37 to 41 VSIM or students in VSIMs. I had PN students, I had BSN students, I had them across the entire curriculum. So it was really challenging. So what I did was break out groups and would put the students that were in 430, NUR 432, I had 3 of them. I put them together in a breakout room and had one of the student navigate through the computer. If you have a small group, let's say one clinical group, which I think is what you're asking, 7 students, they should all have a code and be doing the virtual simulation, the actual VSIM work independently, but the pre-briefing and the debriefing needs to be done together in a group setting. Does that answer your question?
Yeah, it does, but like, do they know what the simulation is like the day before, or are they getting this information the day of, and then we're giving them time to do the reading and the quiz?
Yes, that's a great question. They do not get the information beforehand. We do assign it the day. Let's say, for example, today's virtual simulation started at 9 a.m. I would just make sure everybody can get into the point. Everybody has access to the virtual simulation, which can take a few minutes because if they don't have the code in advance, it takes a little minute to get it ready. And then what I'll do is sometimes I'll share my screen and we're going to do the reading together. I like to talk about the S-bar and ask them, what are the cues and clues that you think might be important? Make a little, sheet or start thinking of some nursing diagnoses. You can ask them. I know, Sarah, I know you're out there. I'm not sure. Sarah Screws is going to be our new part-time virtual simulation. She's certified and she's got extensive experience. And I don't want to put you on the spot, Sarah, but I don't know, have you done it where you just assign the reading to them and then you come back as a group?
I've done it both ways where I've let them do the reading and then come back as a pre-briefing, or we kind of talk through what they already know since it is a clinical day. Sometimes they already know some of the information and then they can use whatever they don't know, they can go look up before they start the virtual sim.
Yes, thank you. Thank you for that. And again, welcome and sorry to put you on the spot.
That's okay. Thank you.
I want to say one thing too is
If I can add too, I've used the product before and I've used it for mental health. What I've had them do is I've actually taken the information, had them go and prepare to know the medications and the basic diagnosis, go and read that information beforehand for their preparation, but not necessarily the sim itself. Just so because students read at different rates, that way they come prepared that way. So I know there can be different ways that you do it depending on the school and kind of what your belief is for that.
Right. And just to reinforce that at the end, I mentioned I do have a presentation and I'll go over the Oregon State Board of Nursing's best practice. And so part of that is doing that pre-simulation and making sure it's done diligently. So the way I've tried to capture that personally is definitely going over this S-bar with students and talking through those cues, clues, nursing diagnoses, what labs might we be looking for, kind of preemptively getting their mind ready and kind of warmed up essentially for the simulation. But thank you, everybody. Great talking points.
yeah. And I think just another thing I'll just touch on that everybody should know is we have full-time student trainers. So as an instructor, anytime you're starting sim for the first time or people need help getting into the point, email me and we can set up a time to kind of join and do just a quick 20-minute orientation on the first week of class so that they know how to get into stuff. Because as we all know, we have too many platforms, we have too many websites, we have too many things, and so it's just like, let's just help get people into this stuff, and then then we're good, But like that first time logging into a new platform, we all face it. It's not always the most fun. Once you find everything, it's pretty easy. But again, just keep that in your back pocket too, as if, you're doing this at VSIM for the first time, there's a big push to do it. We're here to support you. And one of the best resources we have is that kind of service of, there's a woman named Trish, or I'll do it, where we can just join and do a quick Zoom, join your class, get everybody in, so you can just focus on teaching and not worry about platform and codes and all that stuff.
Yeah, I think that's a great point, Matthew. And Matthew has done that for me in the past. I think with the new term coming up next week, those of you who are teaching in courses that use the point, past point, potentially VSIM, not a bad idea to invite Matthew or Trish to come. It takes about 15 minutes, but it really relieves that burden and that stress and anxiety that the students have, wondering, I don't know how to navigate through this. I don't know if I can get on, or if they can't get on, then Matthew's there, front and center to help us. And I've done that, like I said, in the past. I encourage everybody to do that. All you have to do is send him an email, and he's very responsive, and he'll get back with you, and, give him the link and the time, and he'll show up and spend about 15 minutes with the students. And it really is beneficial.
Great. Okay. Should we so let's get back into it. So we have we got through the first part.
Mhm.
The next section of the loop will be that pre-simulation quiz. You can click on that. So this will prompt us the student to take a quick pre-simulation quiz, 10 questions. If you could just click through these quickly, I want to show the answer key.
Oh, do you want me
But
to just choose something for all of them?
yeah, yeah.
Okay.
And so all of these modules will show up in the grade book. So your students will get a score on this that you'll be able to see. You'll be able to go through the answers with them, and you can see at the top it shows how much time they're spending on the question. How they have a 30-minute maximum, but I think the data is always useful to see. Hey, are my students taking it seriously? Are they just clicking through it? What are they actually struggling on? I think that kind of data, as we know, is a very good indicator. If my student's taking 10 seconds per question, are they just clicking through it, or if they're taking too long, are they cheating? It's like let's just kind of I like that information. I think it's always useful for my students to sort of have that information. But as we get through it, and yeah, and then you're going to submit the quiz.
Oh,
And
no.
then you're going to get your quiz results. But what I wanted to show you is why I had you do it. And if you scroll down in the answer keys, you can see that remediation tab, that little remediation button. It tells you where they should go to find the answer in the textbook. So that's why I had you do that. So make sure you point that out to your students, right? What does research say? It's like you got to master a concept, you have to go through it 6 or 7 times, I think, is what I've learned. And for me, every year it gets longer the more times of stuff it takes me to do something. But great. So that's all I wanted to show you. So let's take a look at VSIM. So this is the heart of that third. This is going to be the heart of the module. This is what VSIM does. So before you get into your VSIM, right? You're gonna have to review your SBAR, review your orders, take action. So this is always the first thing that's pulled up. Then you're gonna click launch simulation. And so this is what it's going to look like. You're going to be given a patient. So what's going to happen is your student is going to get once they launch the simulation, I think it's a 40-minute time limit to take care of the patient. In that 40 minutes, we'll review this, but they'll be able to kind of do all the things you would typically do at bedside. You could do a pain assessment, you could administer medications, you can review orders. You're going to have a full EHR that your student to review with doctor's orders. every action that your student takes in the virtual simulation will be graded. It will identify medical errors. It will give them credit for doing things correctly. And if you can see on that bottom, your best result, you see that 53%, that's what I'm talking about. That's the score that they're going to get. Kim, if you could click on that quick tour on the left side, that little button, and
And I
just
just want to chime in really quickly. Our goal for our students for virtual simulation for most courses is 80%. And so they have to do it multiple times sometimes, and sometimes they'll get it on the first try.
yeah.
So,
But I think typically what I find is that it's intended to be done more than once.
This
And
video
that
teaches you how to navigate and care for a patient.
can you
sorry.
mute the sound?
You will be introduced to the patient case through an S-bar.
Sorry. Do you want me to keep going?
Yeah, go back to the beginning and then on the right side just mute the volume because I think it's a nice way to it's a quick walkthrough and then just mute the volume and then we'll actually get into it. But just press play. So this is what it's gonna look like. This is a quick walkthrough of it, right? So this is your students are gonna start simulation and then you're gonna be first given an SBAR report and then the simulation will load. So you'll get an EHR with tabs they can click through with orders, and then it's going to log everything that they do here. But this is what it looks like. So again, it's going to be intended to be done multiple times. As an instructor, you'll be able to see all these actions that they're able to do. So, these are safety measures. You could search. There's over, 200 actions that they can be doing, and it's all going to be recorded as they're going through the simulation. We have a hand up.
So are they going in breakout rooms and doing these? How am I seeing what they're doing?
So sometimes they are going in breakout rooms. Sometimes, as you can see with this particular one, we couldn't get codes to work, but I had access. So I navigated through the computer and give them any feedback. They had to talk through the scenario. But other groups, again, if I've had 7 students and 7 codes, they will do it independently. And then they come back together and we can see their results. They can share the screen and show us the percentage, the S bar. At the end, you have to give an S bar. It gives you a percentage of accuracy for that as well.
Okay, thank you.
You're welcome.
I think it works best when the students themselves are individually doing the simulations. Another option I've seen, something to maybe think about too, if you're kind of do something hands-on, if you're in person, I know a lot of this will be virtual, but if you need to split the group up and maybe focus on a task with a smaller subset, whether that's virtual or in person, you could put the other students into a VSIM, sort of so you can have more attention. It's a nice tool. If you have students that need to make up time during COVID, VSIMs were approved to replace up to 4 hours of clinical replacement time. I'll send that as well afterwards. We have clinical replacement packets that have additional resources in addition to what's online that you can also give to students that can also supplement your time. So again, what you're going to be doing in this simulation, right? You're going to have the students do, you can set the number of attempts and you can set which percentage goes into the grade book. Like, so obviously every time, so why don't you press start, Kim? Every time you get into the VSIM, it's going to record all the actions. So it's going to play an S bar. And then you can also read it. So do you see that read S bar?
Do you want me to play it?
It's okay.
Okay.
Do you want to play it?
I mean, it might be beneficial for everybody to see. We won't do the whole thing, obviously.
Josephine Morrow is an
Just-
80-year-old female with obesity who developed a venous stasis ulcer on her right lower extremity while still living at home. The current plan of care is focused on promoting wound healing, improving venous return, and preventing skin breakdown. Josephine Morrow has a past medical history of chronic obstructive pulmonary disease, chronic venous insufficiency, and deep vein thrombosis. Peripheral arterial disease was ruled out by duplex ultrasound. Her daughter recently moved her to this nearby facility due to concern for her safety related to impaired mobility, an unhealthy diet, and inability to care adequately for herself at home.
Okay, so the remainder of that is the S bar that they read at the beginning for the pre-briefing. Okay, so they're just kind of reiterating. And
You're
then
gonna
if
continue.
you go to continue, you are going to have a few, I think there are, I don't remember how many questions, maybe 4 questions that you have
Four
to
questions.
respond to before you can actually get into the VSIM.
And this little quiz is also recorded too. So like by the time you finish the VSIM, you'll probably have like 4 or 5 different scores to input and evaluate your students on, should you choose to use that in that way.
And this is, I think, what we already showed you, the patient info, diagnostics. You can see the
That's
lab
correct.
values,
Uh,
medication.
yeah, the orders is important, and then also pointing out the patient log. So if you go back to that again, the patient log is basically, if you click on that patient log, that's going to start recording with timestamps everything that your student does. So when they get that score in the end, that's going to give them the breakdown of like critical medical errors from 1X red X to 3 red X's. If they do something right, they'll get a green check. And then that's kind of what's really helpful. So if you click out of that on the top left right hand corner, um, you're gonna see when you pause it, you see that little play pause button on the left hand corner. That's what shows you kind of like what all the fields that they can do. So starting from the top, from the bottom left hand corner, right, we see play pause simulation. If Kim presses play, all these bubbles are gonna disappear. Um, the little running actions is next to it. So that can show you what IVs are running. If you change the position of the body from 45 degrees to 0, that will change. On the right hand corner, there's EHR, there's monitors. So all of these things will evolve during the simulation. So for example, you could put on a pulse ox, and then all of a sudden you'll see the pulse ox. Right now it's not on. So all these things evolve. In the patient will also, the face or their expressions will change based on what you're doing as well. So if a patient's in pain and you give pain medication, they'll be better. Now what Kim has up is sort of where all the interventions and where all the actions will be taking place. So you could click on the subject areas. You can also use that search bar. For example, in the demo, there was, wash hands, blood pressure cuff.
Please state your name and date of birth. My name is Josephine Morrow. I was born on July 30th, 1945.
Sorry, I didn't know I clicked that.
Everything matches.
No, it's great. Anything you want to add here that you like to point out, Kim, to students?
No, I think that's it. One thing I'd like to add is that students may, okay, so, when they're done, they go to the patient handoff. Can I go to that?
Yeah.
Patients may, or students, excuse me, may say, sorry, I'm on my work computer, that it can be incredibly frustrating. If they're omitting steps like I didn't wash my hands, and let's say I ran everything else right through the VSIM. At some point, if I have enough errors, until I do the right thing, it's not going to let me continue on. And it can be frustrating. So I usually tell them in pre-brief, I know this is a computer and you can see how the patient speaks and that kind of thing, but I need for you to really immerse yourself in this scenario and think about knocking on the door, your hand hygiene, put yourself in the situation of what you would actually do for the client, because otherwise they're going to miss those steps. So this
Yeah.
is your S bar, which
And
is after every V.
it won't let you end
Go
the
ahead.
simulation if you don't take it seriously. So that's the one thing you want to point out to students is like, this is a really like, they really build in the steps of being a nurse. So make sure you attack those things properly. Otherwise, you're not going to be able to end it. and you're not going to be able to get to this stuff we're about to see right now. So again, there's an S-bar handoff at the end. So you, just like you would hand off a patient, you're going to hand off the patient here. And then this is what will be the kind of the core readout that your student will get. And obviously, again, so this is you're going to get a simulation score, and then you can kind of see those error breakdowns, right? From 3x to 1x. If you go to tips for improvement, this is where your students will have sort of, I guess, like if they're smart, they will probably take note of the things that they should do the second time through the sim. So like, but again, that's the whole goal of VSIM, right? Is clinical judgment formation, decision making, how to think through being a practice ready nurse, and sort of that learning loop. So that's where it's really helpful. So this is that simulation P that we're talking about. If you can see, we have a little smart link button like that will take us to advisor. You know, point that out. That can also be something that they can really, if you click on one of those, right, it gives you a lot of information on you know, what reference, and it will take you to where you need to go. And then finally you have the S-bar feedback, and then it'll point, you know, point out critical errors.
One thing I want to talk about, I think you mentioned, Matthew, that it is timed, and I believe it is 40 minutes. You can correct me if I'm wrong, but I have had students get timed out before, meaning they didn't finish the simulation prior. And just so you know, they get an automatic 30% deduction, which means obviously they're not going to get their 80% regardless of how they did in the sim. So really encouraging them to stay on time without causing them too much anxiety, but just reminding them that it is a time-based scenario as well.
Okay, so you can close out of this tab and go back. And then after that, you'll have a post-simulation quiz. And then, you know, we don't have to do this one. And then after this quiz, just like we had the pre-sim as a post-sim, there's documentation assignments if you click on that. So what's nice about this is you guys use DocuCare. A lot of you guys are familiar faces from the DocuCare training. Each one of these case-based scenarios have a pre-built EHR in DocuCare. So if you wanted to also integrate VSIM with DocuCare, you have access to that, and you could teach charting. And you can have them. Sometimes I have a lot of my faculty where they'll have one tab open for VSIM, one tab open on DocuCare, so that like as they would be doing in bedside, I've taken care of this patient, I've handed it off, let me chart because I have to go to my son's soccer game in an hour. So we have that all ready to go. And we can talk more about that later about integrating documentation. And then the last part is guided reflection. So Lori, that's a good transition in the assignability function is the attempts. So why don't we close out of this, Kim? Unless there's any more questions. I think we've kind of hammered enough what this is. If you go to assignments, or share your screen.
Oh, sorry.
If we go to assignments, what you will see is actually go back to content. Let's actually create an assignment. We don't have to go all the way through it. But if you go back to content and let's assign Sarah Lynn. So the way you're gonna assign something is you're gonna click on that little plus button. And here is where you're gonna have some leeway as a professor, as the instructor. So you can assign different points to the different activities we went through that learning loop, right? There's a pre-sim quiz, right? Do you see how these match with those 6 kind of tabs on that learning loop? So you can give scores for all these. Click continue. The next thing you're going to do is you can select as an instructor the number of attempts that your students can take, and then you can choose which attempt goes into the grade book. So you could do average attempt, the highest attempt, the first attempt, the last attempt. Um, and so that's something you guys can discuss as faculty. Typically, I would say that you don't want them doing it forever because then they'll probably get 100%, and it might be hard to understand. Are they just kind of clicking through and getting the answers? Maybe I find the sweet spot to be maybe like 3 or 4, and then maybe you take the highest grade. But maybe play around with it and find what's best for your needs. Every student population is different. We want it to be something that's engaging. We don't want it to be something that's just not too easy, not too hard, right? It's like Kim is saying, it would be nice to standardize something. So, maybe you guys could think about that. I would do 3 attempts, or 3 to 4 attempts, take the highest grade. I guess if you're setting a threshold that they have to reach 80, then maybe find that sweet spot of number of attempts, right? Maybe start
Yeah,
with
I feel like, oh, I'm sorry. I was going to say, I feel like in general, I don't think I've had anybody have to redo it more than 3 times recently. So I would say around 3 times is feasible. I don't know, Sarah, if you've got different feedback for that. And I'm seeing something in the chat. Hang on.
Yeah, that's a good idea, John.
Okay, so this would be the next one though. When is the assignment due? As for now, I have it due 7 days after the virtual simulation, and I have it due, for example, if I did it this morning at 9 o'clock, it's going to be due next week on Tuesday at 9 a.m. That gives
Right.
them 7 days to do their post-simulation work, the SBAR documentation, whatever it is, unless we're making up a 12-hour clinical and we have to have 6 hours of virtual simulation, then obviously we'll have time to do that and talk through those assignments.
Yeah, and then just
Is there
know
anything
that
else you wanted to go ahead?
with the grade book, though, one thing I'll share too is I know we're getting close up on time. Is that things won't populate until after the due date. So like it's not like if someone's doing it and it's not closed yet, you might not get all the information until after the due date. So also keep that in mind as well. Go to the results now. So let's see what that looks like for as an instructor, right? So what we're gonna see, right, is for that case-based scenario, each column will be each of those items, right? Each row will be the students that have completed it. So, as you go through the VSIM, you see that health assessment case 1. There's the pre-sim. There's that VSIM score is the one in the middle where that kind of 1 to 100 with that feedback, and then that other one is that post simulation quiz. You could also choose to include the S bars in here if you wanted to. That's all that's going to happen when you're doing that assignment. The last thing I want to touch on is the roster functionality. So what I encourage you all is in that instructors tab, Kim, you can invite other instructors. So you can see if you see that code invite pending button. You can invite any other faculty as co-instructors. And so as co-instructors, they can, you guys can collaborate on some of these courses. And then if you invite someone as a co-instructor, they can also copy the course. I encourage you guys all to at least loop in Kim and or Linda, just in case you need some coverage or you need some help, but also just for like visibility. I think it's good when we're collaborating and using these tools together. Just in this 45 minutes, I've heard so many great ideas about how different people can be using it, and take advantage of that. The last thing I'll touch on is that students tab. So for students to get into this course, you're going to click that invite student button on the right hand side. And I can definitely cover this as you guys get into using it, but that little blue message that invite student is a message that is dictated for the student with step-by-step instructions for them to join this course. So unless they're inside of the course, right? You can't see the resources unless you're inside of a course. So make sure that the step number one is, they're gonna get the VSIM code from from probably Linda or Nick in the registrar's office, and then they're gonna get this course ID from you, so that they'll be able to complete the assignments. Does that make sense? So that's the biggest thing that the only thing administratively you have to do is basically copy this message inside of Canvas or send it to your roster of students that day.
Yeah,
And
I
then
typically will copy and paste this, I'm sorry, Matthew, and put it in an announcement in that clinical course so they have it. But it can also be disseminated, like Matthew saying, in an email or in a message through Canvas. But I do find it's best if you copy and paste it. Otherwise, students will miss a step and then say they can't get in, their code's not working. So it's just step by step. And again, I usually spend the first 10 or so minutes of before we even pre-brief of making sure everybody has access. Okay,
any other
thank you,
questions?
Matthew. Yes, and well, I see a lot in the chat. Let's see what we've got here. Set number of attempts. We did talk about that. We're going to have to kind of really think about that. Right now, as I stated, it really has been more time-based. For example, last week I had some students who only had a 2-hour VSIM, and that was really challenging. So obviously, thankfully they got a 90% on their first time, but I was concerned because they wouldn't have been able to have a second attempt within that allotted time. How many attempts? Will there be a set number of attempts? It would be nice to standardize with the instructors. We are definitely working toward that. John made a good point. Oregon State Board of Nursing gives candidates 4 attempts to pass boards. So that might work, might be the magic number. And you'll find that the students that are new, maybe in our 101 or our 105 classes, are not be as well versed as my 432 students that I had on Friday. They were phenomenal, but they had a 6-hour time window. So we had to do another patient and really get creative with the documentation. So if a student does not pass with an 80% on all attempts, how do we grade this? That is a great question, Lori. I haven't had that happen yet. So these are some really good topics for discussion that we're going to have to solidify. That way everybody across the board is consistent, which is what I'm trying to move to with most things that we do. That way the students know the expectations. Sarah, in your particular past experience, have you had a threshold of 80%? And if they didn't pass, did you have a plan B in place or something of that nature?
We let them do it multiple times, like you're saying. And yeah, 80% is kind of a standard. Some courses further in the program would have them a higher percentage just because we're trying to prepare them to graduate. I have not actually had a student not meet the benchmark. If they're doing it so many times, they should really look at the remediation tips that are given to them after the VSIM so that they can achieve that goal. It pretty much spells out to them what they missed and how they can look up how to do better and things like that.
Yeah, I think that's a great idea. I haven't experienced that either. It potentially could happen, I think, but thus far I have not. And I've been doing VSIMs for a very long time at multiple different universities and colleges. And just here at Sumner so far, everybody's been successful. I think that Matthew brought up a good point that if they get out their pen and paper, or some of them were taking pictures of the feedback. I'm not opposed to that. However you learn best. Because the feedback we know as nurses, the things that we get wrong are the things we learn from, right? We need that rationale, that feedback. So if they take pictures, they take notes, whatever they want to do. Some of them were writing their own S-bars and making creative little concept maps and that kind of thing. But whatever it is, it's really just accentuating their learning experience. And I think they pick up on that usually after time 1, maybe after time 2, and that's why I think most of them do pass it. But John, I see you put something in the chat. John says he does individual remediation within 3-day late period to meet the desired learning outcomes. that's a good way. That might be something we can, talk through and implement. If they choose not to do the remediation, then they lose the points. Okay, and that kind of just plays back into, we're really trying to actively engage them with learning. So any questions? I know that's a lot. There are wonderful training videos within the point, and I think Ashley was going to help me, Mrs. Seagraves was going to help me, kind of put together some more pieces for you after this today. We'll disseminate that. And maybe we can even kind of navigate you to those videos. They're phenomenal to just brush up on. You'll have this again housed at all times in case you need it.
Yeah, I'll send you guys a link to it, but if we had just 2 seconds, I can show you that really quick too.
Sure, go ahead.
Can you share your screen again?
Yes.
So everything I just showed and discussed is available on like short YouTube videos and also like on if you go to training and support on the top right hand corner, it will run through everything that I just showed you. So at the very top of every of our platform, you're going to choose a learner profile, which is a nurse education faculty. And then from here, you're going to choose the product, which is VSIM. And then here, once you click on the view product support, if you scroll down to that getting started with VSIM, that will load a little YouTube playlist, which will walk through all the moves I showed you. But below there is what Kim was talking about, those recorded training webinars. If you click on that module, these are kind of nurse educator led um, tutorials, but also they kind of dive deeper into the deeper dives would be if you could look at those topics, right? They kind of take a little bit of a deep, like larger approach to how different faculty are using these. So, we're one of the biggest adopters. Like our VSIM product is probably the biggest one out there, amongst the other ones such as ATI Elsevier. But we were all of these cases. We built this product with Laerdal, and then all the cases were authored by the National League of Nursing, the NLN. So they're very validated, used in thousands of nursing programs across the country. So don't make life too hard for yourself. Um, we have just a couple resources. I will send all these as well, but Kim, I'd like to share those just really quickly as a send off. I know we have only 2 more time. But we have mapping for all the courses, breakdowns of all the scenarios. I'll send all this information afterwards. But again, in terms of faculty support and resources, we have it. It's probably available. So if you're finding that, oh, like maybe I need a lesson plan or I need some strategies for X, Y, and Z, like send me an email, and I could probably find it for you. So I really appreciate all your guys' time. I know this is,
we appreciate you too.
you know,
Thank you.
these increases in the virtual worlds can be sort of intimidating. But know that we're here to sort of help you guys be successful, so that you can focus on teaching and not trying to find stuff on a website.
Absolutely. Well, thank you so much, Matthew. And if I could just have y'all hang around like 5 more minutes, I just wanted to go over some big pieces. Probably won't get through my whole PowerPoint presentation, but what I'm going to do is disseminate it to you because in an interest of time, I respect that y'all are very busy and do appreciate it. So one thing I want to talk about here at Sumner College, we're not going to have anybody just deciding to do a virtual simulation. It has to go through leadership before that decision can be made, okay? Because obviously the State Board of Nursing in Oregon has stated that we can only do 49% or less of virtual simulation for clinical replacement time. My goal for Sumner College is 25% or less because I feel like our students need to be out there and taking care of patients, but we do know that flu happens, COVID happens, clinical instructors get ill. And so we've got this as a nice, strong backup plan. And in saying that, my presentation, you're going to see it really hones in on the accreditation and the expectations of Oregon State Board of Nursing. And in the future, they are moving to us having to have on staff a certified clinical simulator, which is going to be Mrs. Screws, who's coming on part-time to do a lot of these virtual simulations. She can do some trainings. She's got a wealth of knowledge, and I think she's presented at many conferences and that kind of thing before. So she'll be a great asset to us as well. But just to reiterate, if you are not going to make it to clinical or something is happening, I need you to reach out to me, and then we'll make that decision as a leadership, because I need to look at the groups. How many VSIMs have they already had? What percentage? All of those good things. And again, if anybody needs a brush up, let's say you don't do one, a virtual simulation for 6 months. If you need a brush up, again, this recording, the resources, and my PowerPoint presentation will be disseminated via email. It's also going to be housed in our online faculty content in Canvas, and that way you'll have it as a resource. New faculty members will have it as a resource as well. And moving forward, possibly think about doing some early updates, training, something of that nature. Okay, any questions? I know that's a lot, but really once you get in there and navigate through it, it's pretty user friendly. Okay, well, thank you everybody for your time. Don't forget, if you can make it, nursing faculty meeting on Thursday at 9 a.m. It's only going to be via Zoom, although I am going to be in Portland. I get to travel tomorrow for 9 hours. Yay! But then I'll be there on Thursday, and I'll also be there on Friday as well. So I would love an opportunity to meet with anybody if anybody's on campus on Thursday. So. All right. Well, thank you, everybody. If you think of questions, as always, I'm just either a text message away or an email away. Okay?
Thank you.
All right. Thank you.